Ready? Well, good morning and thank you guys for coming out. Of course, the reason we're here is that we've once again reached a very pivotal point in this pandemic. Only a few short weeks ago, we thought we were returning to some sense of normalcy. And yet, here we are today in August, finding that all of the metrics we follow from the pandemic are now in the red zone again. The community transmission index, percentage of positive tests, and most importantly, hospitalizations. In fact, many of them are literally off the charts and are at all-time highs. As you're aware, this is likely due to several things, including the abandonment of precautions like wearing a mask when out in public and around other people, social distancing, the arrival of the highly contagious Delta variant, which is incredibly more infectious than anything we've had before, and then most importantly, low vaccination rates throughout our area, in fact, throughout the country. Back in December, there was sort of a palpable feeling of hope when we received the very first shipments of vaccine in Chatham County, followed an hour or two later by its arrival in Glenn County. Fortunately, many people took advantage of the vaccine and were vaccinated, but unfortunately, the majority of people have not yet chosen to do so. And so today, we wanted you to hear from our healthcare providers who are on the front lines taking care of those people who are sick with COVID. Sort of in random order, today you will hear from Donna Cochran, who's the Chief Nursing Officer at Liberty Regional in Hinesville, Dr. Alan Brown, who's the Chief Medical Officer at Southeast Georgia Health Systems in Glenn and Camden, Dr. Jeff Kinney, Medical Director of St. Joseph's Hospital Emergency Department, and Dr. Stephen Thacker, the Associate Chief Medical Officer at Memorial Health. We want you to hear directly from them as to how this latest surge is affecting our hospital situation. So, Donna.
Thank you. Good morning. I was asked to come and give you a snapshot of what we are experiencing on a daily basis, probably in the last 10 days. So just this morning, our census at our hospital, which is a 25-bed critical access hospital, is 33 patients. We're housing 8 of them in the ER. We've got 15 on the floor that are positive with COVID. The majority are unvaccinated. A few are partially vaccinated. Our staff are out. We've got 18 staff members out with COVID, and they have been vaccinated. So the vaccine is absolutely something that you can all do to help. We are tired. We're at wit's end. The staff is overwhelmed. Taking care of your community, taking care of your family, possibly watching them die. This is something we have never seen before. It's trying times. I've been doing this for 26 years and never have we seen anything like this. If there's anything that would make you consider getting the vaccine, think about your family, think about your community, think about those that are impacted. Wash your hands, wear your masks, take the precautions. If you're not doing it for yourself, do it for all of these others that are going through this. Thank you.
Next, we'll hear from Dr. Alan Brown, Chief Medical Officer at Southeast Georgia Health Systems.
Thank you. Good morning. I think you're going to hear a lot of just really difficult stories today. Our healthcare system is completely overwhelmed with COVID patients, COVID positive patients, many of whom are in the ICUs. They are, for the vast majority, are unvaccinated. 100% of our ICU patients did not receive a vaccine. The vaccinated patients that we have make up less than 10% of our hospitalizations, and these patients are not young patients. These are more elderly, frail patients that we're seeing that have the breakthrough cases. It's the younger people that are really struggling with this. And I mean, I can tell you about a 33-year-old that we put on the ventilator last week. I can tell you about 27-year-olds that are dying. But for some reason, we cannot get this message to our communities. Healthcare providers realize that this is a pandemic of the unvaccinated and largely avoidable. And that's very frustrating and taxing on the people that are working hard every day, long days, many days in a row, spending time away from their families to care for the folks coming in the hospital. The vaccine helps. You may still get COVID, but you will not end up dying from it. And it's the people that, again, are unvaccinated are the ones that are really sick and getting ICU care. As far as strains on the hospital, our ICU is probably at about 2 times capacity. We've had to cancel elective surgeries, endoscopies as of yesterday in order to just have enough nursing staff to take care of the critically ill patients in our facility, and we're still climbing. So, I don't know where we're gonna be in a week. I don't know if we're gonna have field hospitals, but if we look at the trend that's going on in Jacksonville, that's the direction we're all heading in. And it's scary and it's frustrating, and we just need everyone in the community to do their part to help us get through this. So, thank you.
Thank you, Dr. Brown. And Donna, I know you're needed at the hospital if you want to go. They're over capacity, and Donna's their chief nursing officer. Next, we will hear from Dr. Jeff Kinney, the medical director at St. Joseph's Hospital Emergency Department.
Thank you, Dr. Davis and the Coastal Health District for hosting this. Thank you for having me here. I'd like to speak today about what we're seeing in the emergency departments, one of the front lines in the ongoing fight with COVID-19. We're approximately 1.5 years into this pandemic at this point, and we're currently seeing the 3rd major spike of infections. We currently have 97 COVID-19 positive patients admitted at St. Joseph's Candler Hospital. That's the same level as our prior peak, the highest number of hospital admissions that we've had. Unfortunately, we expect this number to go up. The current projections I've seen are that we're looking at the first week of September before this really peaks and abates. So we're as high as we've been, and unfortunately it's likely to go higher. Hospital beds, including ICU beds, are pretty full. What that means to the emergency department is that patients often board or wait in the emergency department for space. What that does is it limits our ability to provide emergency care to those showing up in the ERs. So what you're talking about are long waits in the waiting room and full waiting rooms and long waits for care. And no one wants to see that. What can be done about that? A lot of the patients that we see coming into the emergency department have mild illness or had an exposure and just want to be tested for COVID-19. I want to remind people that while people do get very sick from this disease and are admitted to the hospital, the vast majority can be safely treated and manage their symptoms at home. And there are a lot of other options where they can be tested. Certainly if you're sick, we want you to come to the hospital and let us evaluate and take care of you. So people ask, well, how do I know? How do I know if I need to go to the emergency room? How do I know if I can treat myself at home? There's a few things. You can find all this on the Coastal Health District's website and on the CDC's website, just to go over them quickly. If you're experiencing trouble breathing, you're struggling to breathe, obviously we want you to come see us. If you're having persistent chest pain or pressure, that's another good reason to see us. Any alteration in your mental status, if you're newly confused, you're difficult to arouse, or a friend or family member is difficult to wake up, that can be a sign. And then looking at people, if their oxygen levels are low, oftentimes you can tell from their skin tone. They may look pale or have a grayish appearance or a bluish appearance to the skin, lips, nail beds. That can be a sign of low oxygen levels. So those are just some. Obviously, if someone feels or looks very sick, they should always come. But those are some of the ways you can tell you should come seek treatment. One thing that we're recommending people do at home is obtain a pulse oximeter. You can obtain one for $20, $30. It fits on your finger and it tells you your oxygen levels. Normal oxygen levels are going to be between 95 to 100%. We start to get concerned when people are consistently below 92%. So those can be obtained if you test positive off Amazon and others relatively inexpensively. Another way to tell, they call it silent hypoxia. Sometimes you can't tell, you might not have a pulse oximeter that your oxygen levels are low. what you're going to notice is these people are working to breathe. You're watching them, your friends or family, noticing that they seem to be breathing fast, or that they're having to stop or pause while they're talking in order to get their sentence out, to take a breath. A normal respiratory rate may be between 60 or 20 breaths per minute. When people start taking 22, 24 or higher breaths per minute, that can be a sign that something's going on with their lungs, and another sign to come seek evaluation. Just to reiterate what was said earlier, 80% of the patients that we are admitted to the hospital are unvaccinated, and the vast majority of those in the intensive care unit and on ventilators are unvaccinated. Getting vaccinated prevents severe illness, hospitalization, and death. It's well proven, it's true. Unvaccinated people should get vaccinated as soon as possible and continue masking until they're fully vaccinated. With the Delta variant, this is more urgent than ever. I want to read to you a brief anecdote. The community has been great supporting the emergency department throughout all this. I remember at the beginning of the pandemic when the community really rallied around healthcare workers. We were getting food from local restaurants almost every night, beautiful messages of support from individuals. Teachers were having students write healthcare hero messages to us, comparing us to superheroes, and it's really cool. We had military flyovers and ranked paratrooper drops over the hospitals. We felt the love and support, and it helped carry us through those tough times. We need your support again. We're asking for your help. Please wear a mask to protect yourself and others, and please get vaccinated. This is the support healthcare workers need right now, and what the community needs to keep us all safe. Thank you.
Thank you, Dr. Kenny, and last but not least, Dr. Stephen Thacker, who is the Associate Chief Medical Officer at Memorial Healthcare.
Thank you, Dr. Davis, and thank you, Dr. Kenny. So, in addition to being the Associate Chief Medical Officer at Memorial Health, I'm also a pediatrician first, and then I got training in infectious disease. And I've spent my career caring for children and young adults who've had infections that span from the minor to the life-threatening. And at no point did I or anyone else on this panel expect that we'd be caring for patients in the face of a global pandemic. And much less that we'd be talking about experiencing the worst of this pandemic nearly 18 months after the first cases reached our region. And certainly not after 6 months after a vaccine that we know can curb this pandemic was made available to our communities. But here we are, we're all bearing witness and testament to the tragedies of this pandemic, and implore all to follow the roadmap that provides a safe passage out. I'd like to share a little bit about our experience of COVID-19 at Memorial Health. We saw our first COVID patient back in March of 2020. We've supported our communities in addition to the hospital systems that support our region throughout this pandemic with the rise and falls of these surges. And now we're in the most challenging period of these 18 months. With the combination of the Delta variant, the relaxation of public health guidance and measures, and honestly inadequate immunization of our communities. We find ourselves here today, physicians and providers from across our region, pleading with those we serve to listen to the stories of these lives lost, families scarred, and hospitals stressed. Really imploring our communities not only listen to the science, but also listen to those same doctors who've been here for you when you broke your arm, the same ones that were here for you when your spouse had a heart attack, and the same ones that were here for you when your father or mother had a stroke. We're the same trusted source that care for your families with evidence-based science, empathy, and guidance that always put you and your health first. 1 month ago on July 9th at Memorial Health, we had 11 patients admitted with COVID-19. 2 weeks ago, we had 36 patients admitted. And now today, we have over 100 admissions admitted with COVID-19, and our community has the highest number of COVID-19 hospitalizations it has ever seen during this pandemic. At this point, you can expect 1 of 2 outcomes with regards to this variant of this virus. One is becoming infected, potentially becoming harmed, and spreading your infection to others because you're unvaccinated. The other is being vaccinated and exposed, where you may have a low risk of mild to moderate symptoms, but you will be well and your life will be spared. So please recognize that individual choices matter. Your choice matters when it comes to vaccination. In the last 7 days, we've had 7 deaths from COVID-19 at Memorial Health, adding to the now over 21,000 mothers, fathers, grandparents, daughters, and sons of Georgia that have died in Georgia hospitals during this pandemic. At this point, through science and research, we've learned a lot about how to better treat this disease and prevent death for most. But we've also learned from this same science and research that the most effective and best strategy to not be harmed by this infection is through vaccination. Death from COVID-19 in the U.S. should be viewed as a vaccine preventable outcome. In the U.S., our state, and our county, we're blessed to have access to safe and effective vaccines against this infection. Now, nearly every loss of life to this virus is a loss that I would argue didn't need to happen. And another reminder that your choices matter when it comes to vaccination. As a pediatrician and a parent, I'm thankful that this virus has impacted children far less than adults, but we're recognizing now that more children are becoming infected and many more are becoming symptomatic and needing hospitalization. The loss of even a single child to this disease is not a fact that we should accept. We're learning every day more and more about the lasting consequences of this infection in both adults and children. For those 12 and older, there's a vaccine that can protect our children. For those under the age of 12, the most effective way that we protect those children from infection at this time is to have those people around them vaccinated. As we gratefully send our children back to school, these decisions have direct impact for our community and our children's future, and your choices matter. Due to this virus, close to 1.5 million children have lost a loved one whose purpose was to raise them. That's 1.5 million children who will grow up without a parent or grandparent or loved one who's going to teach them how to read, how to drive, and was going to be there for those pivotal moments as that child became an adult. If you need a reason other than your own personal safety, then imagine your children and your family without you. Show them you care by getting vaccinated. Your choices matter. Our hospitals are busy and our teams are working very hard to care for you and our community. I'm humbled by their grace, their sacrifice, and unwavering commitment to provide the best care to all of our patients in the face of this pandemic. If you want to support your community, your hospital, and your doctors and nurses who keep you and your family well, recognize that your choices matter. Care for yourself, care for your family, and in doing so, care for your community. Wear your mask, get your vaccine. We need to act now to prevent reaching a point where your community might not be able to care for you when the time calls. If we act now, we can save lives, we can keep families whole, and keep our communities healthy. The choice you make for us all. Thank you.
Thank you all, Dr. Thacker. You heard about the recent increase in hospitalizations. In the past, we thought children might not be infected as often early in the pandemic. But what we know now is that the demographic age group with the highest percentage of antibodies from infection is actually 0 to 17. So more children have been infected than other people. In the last 2 weeks, just in Chatham County, the percentage or the increase in cases in children 0 to 19 has gone up 333%. So we're definitely seeing this virus impact younger people. And I think that concludes everything we have, but we would be open to questions.
Oh, thank you. So we know that vaccination rates are extremely low in our community, not just in Savannah, not just in Chatham County, Long County. I mean, we're seeing in the teen percentage of people fully vaccinated, like 15%. What do we have to do to get this message to people? You all just stood up there and told us you're overworked, you're at your wit's end. What is the deal and how do we get more people vaccinated?
I think we depend on people like you sharing the story in an appropriate manner and sharing the facts with the general population. I think if any of us had a magic bullet or a magic recipe that would convince people who are as yet unvaccinated to take the vaccine, we would all be using that right now. This is literally a plea from your healthcare providers to get vaccinated. And I'm happy to share the podium with others. Yes.
Just an anecdote. A lot of this has been trying to impress upon you the seriousness of the disease and the amount of devastation and hospitalization, but all of us have COVID-19 fatigue. All of us wanted very much badly to get back to our lives. The end of June, when infection rates and hospitalizations were low and masking mandates and everything were removed, everyone was ecstatic to get back to life. I just came from visiting family in Burlington, Vermont, where their vaccination rate is close to 80%. They have also relaxed masking mandates, etc. They are not seeing spikes because that population is vaccinated. People there are able to get back to their normal lives. We're not there, but we could be. That's my message.
This question may be suited for a healthcare professional, but from those who are in the hospital, are you hearing any messages from them about what their experience has been like, if they want to be vaccinated, if they were vaccinated and had a breakthrough case, if they feel differently about that? I mean, what can you tell us about some of these patients who are in the hospital right now?
We've had numerous patients who are struggling to breathe, who are asking to be vaccinated, and I'm sure you've heard these stories. We're having to tell them it's too late for them. Trying to encourage them to pass the message on to their friends and family to encourage them to get vaccinated. That's definitely happening.
I would say that you definitely see some remorse in patients in the hospital with COVID that didn't get the vaccine. A lot of, well, I was thinking about it, I should have done it sooner, that kind of thing. We've heard a lot of that. As far as getting the message across to people, people need to talk to their healthcare providers. They don't need to debunk this social media stuff. Talk to your doctors, people that are in the know. It's lunacy that we are having to drag people out of their own harm's way and make them realize that the vaccine is going to save their life. It's very frustrating. I'm sorry I'm passionate about it, but I just don't know how else to say it. And ironically, a lot of the patients that refuse to take the experimental vaccine have no problems taking the drugs that we're using experimentally in the hospital to try and save their lives. So.
That's a great point. I'd echo that you know, and I'd argue that the vaccine at this point, I think, will shortly be approved by the FDA. And you know, it is so sad to hear about not only our team members but community members as well. They're waiting until their loved one is sick in the hospital with COVID-19, or they have the loss of a family member that's been that reason that they're now pursuing vaccination. You know, just to echo the sentiments raised by everyone, you know, now is the time to act before someone in your life is harmed, someone in your community is harmed from COVID-19, and certainly before yourself is put at risk for a life-threatening infection. And so, again, to echo, you know, you have trusted your providers, you know, prior to this pandemic to manage your heart disease, manage your blood pressure, help raise your child up through health successfully. Leverage that expertise and trusted advisor status that your providers have always been, and get your questions answered and get vaccinated.
I meant to mention, sir, we have patients that are coming in who are fully vaccinated and they're testing positive. So a lot of people have said, what's the point of getting vaccinated if I can still get it? You know, I thought if I got vaccinated, I'm not going to get COVID. Well, that's not the case. As we talked about earlier, you're better protected, but you can still get COVID. But those patients who are upset that I'm telling them they're positive, they almost can't believe it, they're going home and they're recovering. And so I'm having to tell them, look, you know, your oxygen levels are normal, your chest x-ray is clear, you know, you don't feel well right now, but you'll likely be fine in a few days. It could be the other way around. So I think that's the message, is that is the vaccine 100% effective at preventing infection? No, no one ever said it was. Is it extremely effective at preventing hospitalization, serious illness, and death? Absolutely.
Are y'all seeing any uptick in like long haul symptoms with the Delta variant, or especially like even younger people having to deal with the long-term consequences of the COVID infection?
That may be better.
Yeah, so you know, it's come by a lot of different names throughout this, from long COVID to post-COVID syndrome. And to answer your question, we know now that about a quarter of people who've had COVID-19 will have lasting symptoms that can last weeks to months, and some people still having symptoms now. And what we're learning now, as we're discovering that more children were infected than we realized, that there are an increasing number of cases of children with symptoms of long COVID syndrome. And that's, you know, to me, a chapter of this book that's still being written. We don't fully understand the lasting consequence of having had this infection. And what we are learning is that it's affecting our children more than we thought previously.
Okay. And what are some of those long haul symptoms? Sorry, I just wanted to follow.
Yeah, the long haul symptoms are sort of an overwhelming fatigue. that is most common. Some people can have difficulty with their breathing, and including as a lack of tolerance for the activities of daily lives that they used to be able to. So be getting winded with actions you never would have before. And for some individuals, they're having things like headaches and neurologic symptoms that have not resolved.
Dr. Thacker, you have a large, probably, amount of the community who maybe got their vaccine because of the incentives. You don't have to wear a mask, you can travel, things like that. Do those incentives still stand? If I'm vaccinated, am I expected to wear a mask?
The answer to that is it depends on the situation in which you're in. So to your point around incentives, I recognize that we need a lot of these incentives to drive certain people to the table for vaccination. Right now, I think the biggest incentive with this new Delta variant is it is the most reliable way to not become harmed by this infection. And to me, that's incentive enough. From the standpoint of masking when you're traveling, that has not changed for quite some time. As we're traveling in public transit, you remain masked. If you're gathered indoors with individuals that you're not aware of their vaccination status, you should be masked as well. Part of this is us being proactive as communities while we learn and understand what is the consequence of being vaccinated and getting exposed and infected with this virus. Can we share it with others? We don't want to be looking back retrospectively and saying, I wish we had told them to be masked, because we could have prevented more infection and harm to our communities.
Can you guys provide some clearance on how we combat the political and the misinformation of all of the pandemic fatigue? I mean, when we talk about masking, we know there's a political implication to some of people's opinions or feelings on that, along with their vaccination. So how do we combat that and get people to really buy in?
That's a tough question. I wish I had an easy answer. But we have to understand our elected officials under an immense amount of pressure from the community. We talked about COVID fatigue and the strong desire to get the economy moving again, to get people back to work, back to school, and we understand that. Because of that, decisions are not always made following the science. I think we have to go back to, it's unfortunate in our world nowadays that experts are doubted and aren't trusted the way they used to be. I personally haven't seen any reason not to provide that trust. Dr. Fauci, the CDC, I've never seen any reason not to trust them. So I think we need to trust professionals and take what we hear from elected officials with a grain of salt, and we need to follow the science. I heard a quote recently that a lot of some states are really not mandating any mask wearing or restrictions, and almost to the point of outlawing it. And we have to remember, just because you can doesn't mean you should. I like that quote. So we all need to keep in mind, just because in our area it might not be mandated that we need to social distance, wear masks, just because we can elect not to do that, it doesn't mean that's the right thing to do.
On that same note, talking about just because you can doesn't mean you should, a lot of local school districts are not requiring children to quarantine after exposure, close contact exposure. We know social distancing is pretty much not possible this year to get everyone back in school in person. What advice are you giving to parents right now if they come into close contact, if they are in a district where, one, you don't have to wear a mask, it's not required, and two, the students don't have to quarantine if they come in close contact? And I mean, is that frustrating for you? Because that goes against everything the CDC has said.
I think it's a challenging position really for every school system right now to be in, to navigate through these waters of changing guidance, as well as really aiming for that goal that I think we all have, which is for kids to be in school, receiving education in person. We learned a lot in the pandemic about the consequences of a large percentage of our children not being able to be in a school environment. And for me, my advice is that parents should always advocate for what they believe is the healthiest choice for their child. I'd say for school systems, the goal should be that we should have our kids in person in school, and we have to have a layered approach to the protections we put in place to prevent the spread of this virus in those walls. And so in some schools, that's going to be masking. I fall in line with the AAP's recommendation that we should recommend masking universally in schools for children 2 and up and those that can wear them. That includes the children and the staff. I think that is part of a layered approach to protection that all school environments can offer their students and their staff. Recognizing that some schools don't have the space to space out children, or the classroom size is able to basically have everyone educated in person, and that has to be the specific goal. So we need to pair masking guidance with good strategies around cleaning of the schools, keeping kids out of school when they're sick, and having access to testing, and honestly supporting vaccination for those that it's indicated for.
And that's my next question. How are we doing with child vaccinations in our area? I know a lot of parents that I've heard from say they're fine giving it themselves, but they're nervous about having their children take the vaccine. And especially now, as we're seeing more kids getting sick from this virus, I mean, what message do you have for parents that are maybe on the fence, should I get my kid vaccinated?
Yeah, I think to come back to the same messaging that, you've trusted your pediatrician with guidance to keep your child well and help them grow into the successful adult that they're going to be or already have become. So speak with your pediatrician or your family medicine doc about the benefits of COVID-19 if you have a child who's 12 and older. And as a testament, one of my kids is 13. I had no hesitation, knowing what I know as an expert in this field, that the right thing to do for my 13-year-old son was to vaccinate him, not only for his own well-being, but also to protect him as a member of the community. I am not worried that he is someone who will be very likely spread this infection to others. And I instill that in my children, and I hope all parents do, that we have a role for ourselves, but we also have a role and a service mission to our communities as well.
When we talk about the regional impact, I know that obviously in Florida we're seeing a lot of cases. So how does that impact us here in Georgia? And then also when we see some of those smaller communities with low vaccination rates, how does that impact us sometimes here in the Chatham County area? And how does that all flow when we look at the big picture?
The virus is definitely moving north, and it's traveling, at least in our region. Other regions, Mississippi, Missouri, there seem to be epicenters that are moving out. So the impact here is you're going to feel it. It's coming. I heard you guys talk about having 130 patients in Memorial. How many beds is Memorial? Like 600 beds. So they got 130 out of 600. Baptist in Jacksonville has about 720 beds. 582 this morning were COVID patients. We have 250 beds, 121 of ours are COVID patients, and these numbers have gone. July 12th, we had 10. Today, we've got 121. That's how quickly this has happened. It's coming, and it's, in any counties that have low vaccination rates, the hospitalizations are going to be very high. And I'm not trying to spread fear or anything else. It's just, there's nothing you can do about it. And the state like Vermont that have high vaccination rates are going to weather the storm much better than we will. So that's the impact on, Savannah and the local coastal communities.
This is for Dr. Davis. I think we talked to you Friday, and you talked about there were some vaccination rates. There were more people getting vaccinated now, but the rates weren't, high enough yet. Are you encouraged by the fact that at least maybe more people are listening now, and the vaccination, more people are taking the time out now to get vaccinated?
Sure, any movement in the right direction is very welcome. Our numbers of vaccinations that we're giving through the health department have doubled in the last week or so here in Chatham County, and they're going up elsewhere as well, but they're still way too low. I mean, if you double 150 to 300, that's one thing. If you back early in the pandemic, we were giving, I think our high was over 1,400 in a single day. So yes, we're moving in the right direction, but it's slow go, and we'd like to see it move more rapidly. Testing is up tremendously also, 3 or 4 times, but still low numbers. Sure.
It's also important to note that we've talked a little bit about the Pfizer vaccine likely obtaining full FDA approval, not just being under emergency use authorization sometime in the next few weeks. I certainly don't think that it's necessary to wait for that, but I just want to tell you the preliminary data that's coming out, hundreds of millions of doses of this vaccine have been given, and it's proven to be one of the most effective, safest drugs reviewed by the FDA. It's almost guaranteed it will receive full FDA approval. Once it does, I think there will be some people who are on the fence and unsure who hopefully will get vaccinated. I'm hoping they decide to do it even before that. But I think at that time we may see more businesses, healthcare institutions, and others issuing vaccine mandates. And I personally don't necessarily think that's a bad thing.
I'm reading some of our comments on our live feed of this, and people are saying, you know, this vaccine came so quickly, we don't know the long-term effects, it's too rushed. Is that a big, big pushback that you're still getting 6 months later after this has been made available to everyone?
Yes, people are still saying that it's an experimental vaccine. It was rushed, it was pushed through. Obviously, it's been a stressful year and a half, but the science behind this vaccine is not new. It's not rushed. It's been around for years. This is just a new way of delivering that in vaccine form. So again, at this point, you've had 7 months, 8 months of hundreds of millions of doses with safety, efficacy. Really, if you're on the fence at this point, I'm not sure what you're waiting for.
Prior to this Delta surge, a lot of people who had antibodies from previous infection may have thought they were protected. A study came out last week about how much the vaccination helps those who have previously been infected. What do we know about that?
Yeah, so that was a great proof of what we kind of already knew around the benefits of vaccination for those that were even infected. Just due to the nature of how our immune system responds to natural infection, what we found was that the antibodies that you make following natural infection were less overall protective against these new circulating strains compared to this very targeted, focused approach to generating a protective antibody response with a vaccine. So all that said, that if you're someone who's had natural infection with COVID-19, you have the same recommendations I would give someone who's not, that you should receive vaccination. We have now a growing body of evidence that it is the best and most effective way to protect yourself against reinfection, which I know many of us have already seen come through our hospitals at this point in time, and that rate is starting to rise now that the Delta variant is the predominant strain in Georgia.
Okay, we'll wrap it up.
Thank you.
Thank you very much.
Thank you very much.